Hello, my name is Colin Flynn. My pronouns are he and him. I'm with the Maryland Department of Health, where I'm Chief of the Center for HIV Surveillance, Epidemiology and Evaluation. The title of this presentation is HIV Epidemiology in Maryland among Transgender People. In the Maryland Department of Health, HIV surveillance is part of the Prevention and Health Promotion Administration. Our mission and vision statement is presented to you here. A key point to this mission is that we seek to provide public health leadership through community-based public health efforts in partnership with many organizations and community groups. First question is, where did the data come from? Maryland law requires healthcare providers to report people with diagnoses of HIV or AIDS. It requires laboratories to report HIV-related test results, and for providers to cooperate with the health department investigations. The state and local health department attempt to interview and provide partner services to all people with a new diagnosis of HIV. And the HIV surveillance program investigates all people reported to be living in or receiving care in Maryland with HIV to ensure that we have complete, accurate, and unduplicated information. In this slide, we present the HIV diagnosis trends over the last 10 years. The purple line indicates the number of new HIV diagnoses in each year from 2010 through 2019. As you can see, there's been a steady decline in the number of new diagnoses from just under 1,800 in 2010 to under 1,000 in 2019. This is a 47% decrease over this 10-year period for an estimated annual percent change of minus 5.9%. This slide shows you people living with diagnosed HIV on 12/31/2019 by gender. There are 33,976 people living with diagnosed HIV in the state of Maryland. Of those, 22,000 or 65% were male, cis male. 11,500 were female or cis female, 34%. The trans female are 309, or about 1%, and trans male are 21, less than 1%. So how do we know someone's gender? Providers, unfortunately, often only collect and report sex at birth. The partner services interviews mentioned earlier do collect gender information. And when we investigate, gender status is often documented in medical records. In addition, name and gender changes are recorded in official documents such as driver license records. We routinely review all incoming surveillance reports to identify people who have records with different names, sex at birth, and or gender that might indicate a person is transgender, and then investigate to confirm their status. What we typically see is that people are getting care at multiple locations, and that these reports have a mixture of names and aliases, or reported sex or reported gender. And so when this occurs, we then follow up and investigate and contact the provider, contact the patient, and try and determine what the actual status of this person is and what the correct values are. In this slide, we show the HIV diagnosis trends over the 10-year period for transgender people. As we saw earlier, there are more trans female persons than trans male. We've been experiencing 2 or fewer trans male diagnoses per year, with no discernible trend in the number. Trans female, the numbers have decreased over this time period, as we saw statewide, from 30 diagnoses in 2010 to 14 diagnoses in each of the last 3 years. This slide is a representation of where you might find transgender persons living with diagnosed HIV across the state. The largest proportion, just over half, are residents of Baltimore City. The next largest groupings are Prince George's County with 17%, Baltimore County with almost 9%, Anne Arundel County with about 7%, and Montgomery County with 5%. These are somewhat similar to what we see for HIV diagnoses in general, but with a larger proportion in Baltimore City than we might otherwise see. In this slide, you see the current age for persons living with diagnosed HIV, transgender persons. There are 330, so we are combining the trans male and trans female in this. The largest group by far are folks who are in their 30s, 30 to 39-year-old, just under 140 people living with HIV in that group, followed by folks in their 20s with just under 80, and then smaller numbers in the older ages of 40 to 49, 50 to 59, and 60 plus, with very small numbers in the 13 to 19 and none under the age of 13. In this slide, we see transgender people living with diagnosed HIV by race ethnicity. So again, for the 330 folks, 3/4 of them are non-Hispanic Black, 13% are Hispanic, 6% are non-Hispanic White, and 6% are multiracial, non-Hispanic multiracial. And multiracial typically are folks who are reporting being Black and White. We had no transgender persons with HIV in the other race ethnicity categories. In this slide, we look at the HIV exposure categories for persons living with diagnosed HIV who are transgender. These are somewhat different than the typical transmission categories used for HIV statistics, in that the labelings of sexual partners are not necessarily appropriate. In addition, we're presenting it here so that there can be overlaps between sexual transmission and injection transmission. From the top line there, for injection drug use, 11% of the trans females are reporting injection drug use, while a higher proportion, 28.6% of trans males are reporting injection drug use. 66% of the trans females reported having sex with males only, while 52% of the trans males reported having sex with males only. Just under 3% of trans females reported having sex with females only, and none of the trans males reported having sex with females only. 26% of trans females reported having sex with both males and females, and 38% of trans males reported having sex with both males and females. There were small numbers of transgender individuals who acquired HIV through perinatal transmission, and about 4 to 5% of transgender individuals who had no reported HIV risk factor. In this slide, we present the HIV care markers for transgender people in the middle columns, and then for comparison purposes, the Maryland totals in the far right column. So in the top rows for new HIV diagnoses in 2019, as mentioned earlier, there were 14 amongst transgender individuals and just under 1,000 in Maryland as a total. So those 14 transgender HIV diagnoses represented 1.5% of all the new Maryland HIV diagnoses in 2019. 12 of the 14 were linked to HIV care within 1 month for 85.7% linkage to care rate, which is just slightly lower than the Maryland total of 87.4%. Only one transgender new diagnosis was a late diagnosis, which means that within the 12 months after their HIV diagnosis, they were also diagnosed with AIDS. That's a 7.1%, which is substantially lower than the 24.7% for Maryland as a whole, but it's a very small number of individuals, so this percent estimate is probably unstable. The bottom rows are for persons living with diagnosed HIV at the end of 2019. So again, the 330 number, which we saw earlier, and as mentioned earlier, that represents 1% of all of the people living with HIV in the state of Maryland, diagnosed with HIV. 279 of the 330 are reported to be in care, which means that they had CD4 and viral load testing done in the last 12 months for 79%, a little bit lower than the Maryland total of 84.5%. 16 had their most recent CD4 test results under 200 cells per microliter, which would be an indication of their immunosuppression and an AIDS diagnosis. That's a rate of 4.8%, which is somewhat lower than the state total of 8.1%. And 236 reported at their last viral load test during this 2019-2020 period was virally suppressed for a viral suppression rate of 71.5%, just slightly higher than the state average of 69.8%. So all in all, the care markers for transgender individuals are consistent with what we see for the HIV population as a whole in Maryland, although for the new diagnoses, the numbers are somewhat small, and so one must be cautious over generalizing from these numbers. So those are the HIV surveillance data that we have on transgender people living with HIV, diagnosed and living with HIV. But there are some limitations to these data. Over the last 10 years, there have been substantial improvements in our data systems in general, and in particular as it regards to identifying and reporting transgender individuals. During this time period, we've done substantial cleaning of the data, improved our processes, improved our data system, and the number of identified transgender persons in the HIV data has more than doubled. There are, however, still some important data limitations. Transgender status is likely unreported for some people. Some people, despite our efforts to deduplicate, may be double counted under different names and genders. The gender categories that we have do not adequately represent non-binary people. And we are unable to describe when someone transitioned or where they are in their process. So we are able to indicate that someone at some point is or was transgender, but we are unable to put dates on when that occurred or what their current status is. So given those caveats, we are pleased that we do have some data and that it is fairly robust, and that we tend to have enough numbers to make some inferences from these numbers. Thank you for your attention at this time.